Dr. Ashish Jha now, Dean of the Brown University School of Public Health. Doctor, thank you. Cases and hospitalizations skyrocketing in some areas as more students are going back to school. In different parts of the country, local officials are giving really different messages about masks. In your estimation, can parents feel comfortable putting their kids back in school right now?
Yeah, Shep, thanks for having me here. It really depends a little bit on where you are, but in much of the country, infection numbers are so high that while I think every kid can be back in school full time now in the fall, not without making some sets of policy changes. I think adults need to be vaccinated. I think we need to improve ventilation in schools. Again, the schools have had a year to do this. And yeah, I think in high transmission areas, masks make a lot of sense. I just wish we didn't politicize this and just do the things that we know that are necessary to get kids back into school safely.
But it is politicized. And so what's a parent who understands the science and realizes the importance to do when he or she says, I can't let my 11-year-old do this. He's immunocompromised and nobody's wearing masks and I'm scared to death.
Yeah, that's a heartbreaking scenario. Look, I think if school districts wanted to take kids' health and well-being seriously, they could do this. Obviously, if you have an immunocompromised 11-year-old and there's nobody masking up, and if the teachers are not vaccinated, there's no ventilation, no testing happening in schools, that makes it much, much more dangerous. And that breaks my heart for that kid and for that parent. And they've got to make some difficult decisions. We shouldn't have those choices. We can get everybody back in school full time now, and we know how to do it. We have the resources. It's frustrating to me that we're not implementing the policies that we know work.
It's day 4 of the Sturgis motorcycle rally out in South Dakota. Around 700,000 people expected to show up for this. This was the scene earlier today as they were blocking things off. Dr. Fauci said he's concerned that this could lead to another surge. Is it too soon to bring back events like this, or outside in the main, are we okay?
Yeah, so the Sturgis rally outside part doesn't bother me at all. I think it's fine. The issue is, when you're there, what we saw last year, the reason why the Sturgis rally set off such a large infection is because, of course, in the evenings, people are inside bars and they're packed and the restaurants are packed. And of course, there's no masks. A lot of these folks are not vaccinated. And so I do worry about what the consequences of this will be. If everybody could get vaccinated, if we get 95% of America vaccinated, yeah, rallies, schools, everything would be much, much easier to do. We're just not doing the thing that we need to put this pandemic behind us.
One question that my friends and I have had, with Delta spreading like it does, like chickenpox, as it's been said, and traveling farther within enclosed spaces, is it safe for us to be eating dinner in a restaurant indoors or not?
Yeah, this is a really good question, Shep. And I'll tell you, May, June, I was eating dinner inside. I have stopped eating inside at restaurants, and I'm now mostly doing it outside. If there are restaurants that are moving to vaccinated-only patrons, there I would do it. But when you are mixing unvaccinated and vaccinated people together in high transmission areas, I think it's risky, and I think it's better if you can eat outside.
Yeah.